Principles of pharmacology. We'll be going through a number of objectives. All right. So medications are an important intervention available to you as an EMT. Just like other members of the healthcare team, like your nurses and your paramedics, you must understand medications that are within your scope of practice. When used appropriately, medications may alleviate pain and improve a patient's condition. But failure to administer medication safely and competently can lead to serious consequences for the patient, including death. Can you imagine if you use a medication at a dose that is probably 10 times that of an adult? Can you imagine the consequence that that may bear on the outcome of the patient? So it's very important that we administer medications safely. All right, how medications work. All right, pharmacology may be defined as the science of drugs, including their ingredients, preparation, uses, and actions on the body. A medication is a substance that's used to treat or prevent disease or relieve pain. Pharmacodynamics. This is the process by which medication works on the body. A medication can either produce an effect or block the receptors to prevent other chemicals or medications from working. And so we come to agonists. Agonists cause stimulation of receptors. For example, as an EMT, you will come across a medication called Ventolin, or salbutamol being the active ingredient. Now, this medication is known as a beta-2 agonist. So what it does is that when it binds to beta-2 receptors, it causes bronchodilation of the airways. And this can be used to treat your asthmatics when they're having an asthma attack. Antagonist. Antagonist binds to a receptor and blocks other medications or chemicals. For example, using the same beta receptors, you have what are known as beta blockers. Now, when these beta receptors are stimulated, they normally cause vasoconstriction, that is constriction in the blood vessels, and they also increase heart rate. The cumulative effects of this would be an increase in blood pressure. Now, an antagonist would be like a beta blocker. So it occupies these beta receptors and lowers the blood pressure. An example of a beta blocker that you may meet in the field is like atenolol, which blocks beta-1 receptors, or propranolol, which blocks beta-1 and beta-2 receptors. The dose is the amount of medication that is given, and the dose depends on a patient's weight. For example, in your pediatric patients, you normally see physicians ordering doses based on milligrams per kilograms. Also depends on the patient's age. For the very young, they may not be able to metabolize a large amount of the drug, and the very old as well. For the very old or persons, their kidney functions or their liver functions may not be as when they were in their 20s, and so the dose has to be adjusted accordingly. The desired action of the medication also determines the dose. For example, a common over-the-counter medication, which some of you might have heard about, would be milk of magnesia. For milk of magnesia, when you give milk of magnesia at 2 teaspoons 3 times per day, then it has an antacid effect, meaning that it neutralizes the acid in the stomach, so it can be used to treat stomach burns. However, if you give it at 2 tablespoons once a day, and you advise the patient to drink a lot of water, then that can be used to treat constipation. So you see the dose is the desired action can actually determine the dose of the drug. The action of the drug is the therapeutic effect that a medication is expected to have on the body. Pharmacokinetics. The pharmacokinetics is really the actions of the body upon the medication or chemical. In pharmacy, when we talk about pharmacokinetics, we look at the absorption of the drug, the distribution of the drug, the metabolism of the drug, and the elimination of the drug. This will determine the onset of action. For example, the time that the medication, that is the time from which the medication is administered until it has a clinical effect. For example, if you give ibuprofen now, then within half an hour, the patient should begin to experience a relief in their painful symptoms. The duration is the length of time that that clinical effect persists. So, for example, you give a dose of ibuprofen, you're expecting it to provide pain coverage for at least 8 hours. The elimination, how medications or chemicals are removed from the body. And this, for most medication, they are highly metabolized by the liver and excreted by the kidneys. The peak is the point or the period when the maximum clinical effect is achieved. Factors affecting how medications work. The route of administration of the drug affects how it works. Whether or not it's the oral route, the nasal route, intravenous, intramuscular, all of which we'll see shortly. For example, you would not give a dose of insulin orally because once the insulin is ingested, then the hormones in the stomach will destroy the insulin and it will have no therapeutic effect. So the preferred route of administration for insulin would be subcutaneous. Shock states. This also affects how medications work. Remember that during shock, then blood is distributed away from your non-essential organs and directed towards your brain. This has implications because remember, for example, if you take a medication orally, absorption occurs in the stomach. Now, if blood is directed away from the stomach and towards the brain, then what this means is that absorption is slowed or delayed. Similarly, the liver and blood supply to the liver and the kidneys may be affected. And so the elimination of the drug is also affected. So the drug stays longer in the body. And for drugs with a very narrow therapeutic index, you do not want drugs to accumulate like this. All right, moving on. Indications. These would be the reasons or the conditions for which a particular medication is given. Contraindications. These are situations in which a medication would either harm the patient or have no positive effect. Absolute contraindication. These are situations in which a medication should never be given to a patient. For example, in the 1970s, we have a situation in which this drug called thalidomide was developed in order to help morning sickness in pregnant women. Now, after these babies began to be born, then they were born without the proper development of the limbs. So this would be a total contraindication. Thalidomide is absolutely contraindicated in pregnancy. Relative contraindications. These are situations in which the benefits of administering the drug may outweigh the risks. For example, if a patient is having a severe anaphylactic reaction, then we have to administer an EpiPen in order to save the patient's life. And a side effect of an EpiPen is an increase in the blood pressure. Suppose the patient has a history of high blood pressure. We still have to give it because the benefits would have outweighed the contraindication. Adverse effects. Adverse effects would be any action of a medication other than the desired ones. Unintended effects. These are effects that are undesirable but pose little risk to the patient. When you give your patient 2 puffs of Ventolin inhaler, then they may start to experience an accelerated heart rate as well as fine tremors in the extremities. These side effects are harmless and they will pass. So that would be an example of an unintended effect because it still causes bronchodilation to relieve the asthmatic attack, but it causes the fine tremors as well as the increase in heart rate. Untoward effects, though, these are effects that can be harmful to the patient. For example, if a patient, we have a very common medication that's used here in Jamaica, enalapril. It's used for high blood pressure. But as a side effect, it can cause what is known as angioedema, which is swelling in the facial area. The swelling may become so severe that even the throat and the tongue swells to the extent that it obstructs the airways. Another example would be like your cholesterol drugs. Like they cause a condition called rhabdomyolysis, which what happens is that there's a breakdown of muscles in the body and the byproducts actually seep into the blood and actually shuts down the kidneys. So the patient would have a damaged kidney. That's an untoward effect. All right, now we come to medication names. A medication name, you can have a generic name of a drug. This is a simple, clear, non-proprietary name. Generic drugs are not capitalized. For example, the example that is given here is ibuprofen. Now, ibuprofen in Jamaica, it exists in many products, but what we call it ibuprofen or brufen. That would be just the generic name of the drug. The trade name now is the manufacturer's brand name. These names normally begin with capital letter. One drug may have more than one trade name. Same example here, ibuprofen. In Jamaica, we have it as Motrin or Advil. The other example that is cited there, Tylenol. Tylenol is the same thing as Panadol or cetamol. All of these have in what is known as acetaminophen. For medications are classified differently. You have prescription medications. These are only available by a physician's order or prescription and is dispensed by the pharmacist. You also have over-the-counter medications. In Jamaica, over-the-counter medications, we have list 1 and list 2 medications. List 1 medications are only supposed to be supplied or carried in a pharmacy, sorry. You have the other list of medication, or like your Panadol, you can find them in the corner shops and so forth. But the list 2, only found in the pharmacies. List 1, you can find them like at your corner shops like Panadol. List 2 would be like your Histotusin or your Panadol multi-symptom. Recreational drugs. These are drugs that cause you to have a good time, feel nice, feel high, like your heroin and your cocaine. Herbal remedies. Herbal remedies are drugs that are derived from plants. Like, for example, in your post-menopausal woman, you see them taking evening primrose or chamomile for sleep. Enhancement drugs, these are drugs that are used a lot by the male population in order to increase their sexual performance. Vitamins. Well, since this COVID-19 thing, this has been a very popular group of drugs. Vitamins. Everybody wants their vitamin C, their zinc, their vitamin D3. And then there are alternative medicines. This is like your acupuncture, your chiropractic techniques, and so forth. All right, routes of administration. Enteral medications enter the body through the digestive system. They're often in pill or liquid forms. Medications administered via this route tend to be absorbed slowly and are not commonly used in an emergency setting. Parenteral medications are those that enter the body by some other means. They're often in liquid forms and are administered through needles or syringes. They're absorbed more quickly, and these are the ones that you'll find in your emergency setting. Absorption is more predictable and the response is more measurable. Absorption is the process by which medications travel through body tissues and into the bloodstream. So from the time that you take it to when it enters the bloodstream, where it would be distributed to the site of action. Common routes of administration: per rectum, which you'll see PR, which is by the rectum. This is easy to administer and provides reliable absorption. There's also PO or oral, which is by mouth. But these medications, they can take as long as 1 hour to be absorbed. You have the intravenous route that's into the vein. It's the fastest delivery, but it cannot be used for all medications. For example, your medications that are available in suspension forms, like particles are suspended in it, cannot be used for intravenous. The intravenous route cannot be used. Intraosseous. Now, this is into the bone. It reaches the bloodstream through the bone marrow. This requires a needle to actually get drilled into the outer layer of the bone. It is not usually a very common route, and is only used if the intravenous route is not accessible, such as during severe dehydration. The subcutaneous route, this is beneath the skin. Injection is given into the fatty tissue between the skin and the muscles. There's also the intramuscular route, that's into the muscles. It's absorbed very quickly because muscles tend to have a very good supply of blood. Not all medications can be administered via this route though, and it's normally associated with pain, so that's a disadvantage of that route. Inhalation. This is medication that's breathed into the lungs. It absorbs into the bloodstream quite quickly. The forms include aerosols, fine powders, and sprays. Sublingual, this is under the tongue, and you will meet some of these in the emergency setting. It enters through the oral mucosa under the tongue and is absorbed into the bloodstream within minutes. For example, your nitroglycerin given to patients with angina. When you put that one tablet under the tongue or that one spray under the tongue, it takes less than 5 minutes for the pain, the chest pains, to be resolved. Transcutaneous or transdermal route, this is through the skin, and it's applied as a patch to the skin. Again, nitroglycerin is given via this means. The patch is applied on the chest. It lasts longer than the other routes. Intranasal. This is the medication is pushed through the mucosal atomizer device that aerosolizes the liquid and delivers it into the nostril. Very quick absorption. This is seen like during administration of naloxone when you have an opioid overdose. That is one too that you may see in the emergency setting, although not very common here in Jamaica. And this is just a table showing you the routes of administration and the rates of absorption. If we see the intravenous and intraosseous route, almost immediate rates of absorption, followed by your sublingual and per rectum route, which are rapid. The slowest routes would be your subcutaneous, transcutaneous, and by mouth routes. All right, so the medication form usually dictates the route of administration. The manufacturer chooses the form to ensure, one, proper route of administration, the timing of the medication release into the bloodstream. For example, you have some tablets that are controlled release. I particularly remember this particular sleep aid. It is a controlled release drug called Ambien CR. So when you take that drug, it enters the stomach. The way all the tablet is designed, the first layer releases and gives you sleep within 30 minutes. And then over time, as the drug passes into the intestine, then the other layer starts to slowly release the drug. So it keeps you asleep. So the immediate portion helps you to fall asleep quickly, and the other portion helps you to remain asleep until in the morning. The effects on the target or organs of the body. So manufacturers normally choose a route of administration depending on the effects on the target organs. For example, we wouldn't give, in the emergency setting, if somebody is having an asthma attack, we wouldn't give a Ventolin tablet. We would choose the Ventolin inhaler, because when it goes directly to the lungs. So it bypasses the stomach. You don't have to let it go into the stomach, then be absorbed into the blood, then taken to the lungs. No, it goes directly to the lungs, which is the site of action that you want the drug to act. All right, so now we're going to be looking at some enteral or oral routes, oral dosage forms, sorry. You have most medications that are given by mouth are either in tablet or capsule form. Capsules like for example, your amoxil capsules, a lot of Jamaicans tend to know that one, the red and yellow capsule. Right, these are gelatin shells that are filled with powder, or even your cod liver oil capsules. Those are filled with liquids. Tablets are also very common, and they contain other materials that are mixed with medication and compressed so that the medication can be in a form that the patient can hold and take. Also orally taken would be your solutions and suspensions. A solution is a liquid mixture of one or more substances that cannot be separated. Solutions, though, are given by almost any route. When given by mouth, solutions may be absorbed from the stomach fairly quickly because the medication is already dissolved. Many solutions are also given in IV, IM, or subcutaneous injection. The suspension, though, is a little different. A suspension is a mixture of finely grounded particles that are distributed evenly throughout the liquid. But in order to have this even distribution, you have to shake it or stir it. Once you put down a suspension, it normally separates. A lot of your children antibiotics are like this. So for example, your augmentin, pediatric augmentin, you normally have to give it a good shake before giving the dose. It's important for you to shake suspensions properly before administering them, because that's the only way the medication will be evenly distributed and be of benefit, therapeutic benefit to your patient. Right, so for metered dose inhalers, another dosage form, liquids or solids that are there, these are liquids or solids that are broken down small enough into droplets or particles that are inhaled. The spray canister directs such substances through the mouth and into the lungs. It delivers the same amount of medication each time it is pressed down. It's often used for respiratory illnesses such as asthma and emphysema. Topical medications. These are the ones that are applied to the skin surface. These include lotions, creams, and ointments. Example of lotion would be like your calamine lotion. These are a little more runny than the creams. For example, your hydrocortisone cream, which is used for like insect bites and eczema. And then your ointments, these are just a little more oily than the creams. Transcutaneous medications, also referred to as transdermal medications. These are absorbed through the skin, and many transdermal medications have systemic or whole body effects. For example, again, your nitroglycerin patch. When you put on the patch on somebody, it relieves the chest pain associated with angina. If you touch the medication with your skin, you as the EMT will absorb it, and the effects will be just like that in the patient. So you have to wear a glove. Semi-liquids or gels. Gels are semi-liquids. They're administered either in capsule form or through plastic tubes. We have an example there of your oral glucose for a patient who has diabetic who has gone hypoglycemic. Gases for inhalation. Usually outside the operating room, the most common gas for inhalation that we will come across would be oxygen. It's usually delivered through a non-rebreathing mask or a nasal cannula. Medication should only be administered under the authorization of medical control. We should always follow the rights of the patient. Right patient. Ensure that the patient who needs the medication is the person who receives the medication. Oftentimes, I have patients who come to tell me, oh, miss, I know that my blood pressure is high. My grandmother was prescribed this blood pressure medicine 3, 4 months ago. Mine is high, so I just take one of her tablets. No, the medication was not prescribed for that patient. So always ensure that the medication is for the right patient. Right medication and indication. 1 minute, let me change the slide. Right medication and indication. Verify the proper medication and the prescription. So is this the right medication? Is this the patient needs it for asthma? Is it a medication for asthma? Need to make sure that it is. Right dose. Verify the form and the dose of the medication. Right route. Verify the route of the medication. For example, can you imagine having a suppository, like gravel suppository, that is supposed to be administered via the rectum? Can you imagine having a patient swallow that instead? Very, very serious implication. Right time. Check the expiration date and the condition of the medication. The expiration date. Sometimes, especially your elderly medication may have elderly patient, may have a medication for quite a number of weeks or months. Medication is no longer it has been expired. Also, the condition of the medication. Is it that this medication was supposed to have been kept on the fridge and it was out for an extended time? For example, your insulins. A lot of insulin should be kept on the fridge. If it has been off the fridge for an extended time, you'll see that the medication is no longer, it's discolored, and it certainly cannot be administered subcutaneously. Right education. Inform the patient of the medication you intend to administer, including any likely side effects or unusual sensation he or she may experience. If you're going to be administering a nitroglycerin tablet, ensure to tell the patient, hey, sit down, because when you put this tablet under the tongue, you may feel a little dizzy. And afterwards, though, you may have a headache. Educate your patient. The right to refuse. Patients with decision-making capacity can decline or refuse proposed interventions or medication. And of course, as an EMT, this needs to be documented. Right response and evaluation. Monitor the patient's vital signs, mental status, signs of perfusion, and respiratory effort after medication administration. You're going to assess for the anticipated response and observe for any adverse medication effects. Right documentation. You should document your actions and the patient's response. If it is not documented, then you did not do it. Always remember that. It is important too that when you get a verbal direction from medical control, then you need to repeat the direction and verify that you're giving the right dose or the right drug to the right patient at the right dose. This will reduce medication errors. All right. Circumstances in which medications may be administered. You have peer-assisted medication. This is when you administer the medication either to yourself or to your partner. Suppose you have biological warfare chemicals and you need to, for example, you need to give an antidote to yourself or to your partner if either of you guys were exposed, then that's peer assisted medication administration, sorry. Patient assisted medication. You, in this situation, you assist the patient when administering his or her own medication. For example, if a patient have the EpiPen, which is the epinephrine auto-injector, you may help to administer it to the patient. Or if a patient has a metered dose inhaler, like for example your Ventolin inhaler, then of course you can help the patient to administer it as well. Same thing with your nitroglycerin. Can help the patient if they have their own, help them, direct them to put it under the tongue. EMT administered medications. Well, this is when the EMT directly administers the medication to the patient. The patient may be severely confused or may be unable to understand the need for the medication. For example, oxygen, that's an EMT administered medication. Oral glucose, such as when your diabetic patient is hypoglycemic, or aspirin if there is a suspected myocardial infarction. Medical control, state guidelines, and local protocols will determine what an EMT in your system may administer. So you're going to refer to your local standards to obtain a listing of how and when EMTs can administer medications. All right. For oral medications, let's go through how oral medications are to be administered. First, you're going to take standard precautions. Your gloves, your mask. Confirm that the medication is not expired. So you look at the medication. Normally, on the medication label, you will see something called MFD. That is the date of manufacture. That's the date it was manufactured. And then EXP, that's the expiration date. Sometimes you don't see EXP, but you see VEN. That's also the expiration date. Obtain medical direction per local protocol. Confirm that the patient has a patent airway and is able to swallow or chew the medication. Never put something in a patient's mouth. A patient that is unresponsive can't put anything in their mouth like a medication. Monitor the patient's condition and document. For example, if you're giving oral glucose is a sugar that, glucose is a sugar that the cells use for energy. It is necessary for brain cells to survive. Hypoglycemia happens when there is extremely low blood glucose. So this is when we give our oral glucose, which will then counteract the effects of hypoglycemia. An EMT can give glucose only by mouth in the form of a gel. Never administer oral medication to an unconscious patient or to one who is unable to swallow or protect their airways. Aspirin. Aspirin is used to reduce fever, pain, and inflammation. It inhibits platelets aggregation, that is the clumping together of platelets, which can cause clots, which worsens a suspected myocardial infarction. So it is very useful to give aspirin during a potential heart attack. It's contraindicated in patients that are hypersensitive to aspirin or to NSAIDs. Aspirin belongs to a group of drugs called NSAIDs, which would include like your cataflam, your Voltaren. So if the patient is telling you, oh, you're asking in your sample history, what medication are you allergic to? The patient say, oh, I'm allergic to cataflam or I'm allergic to Voltaren. Then this means that there is a high probability that the patient is also allergic to aspirin. Contraindicated in pre-existing liver damage or bleeding disorders and asthma. If somebody has a bleeding disorder and you give aspirin, that can cause the bleeding to be worse. All right, if the patient should, for example, get a cut, it will definitely start to bleed a lot. In asthma, these medications like aspirin, a side effect is that they cause the accumulation of salt and by extension, water. Because anywhere salt is accumulated, water follows. So it can lead to edema in the airways, the bronchioles. So definitely we don't want to give our asthmatics aspirin. It should not be given to children, especially children exhibiting flu symptoms. In these children, it causes a syndrome called Ray's syndrome. Ray's syndrome is where the acidity of the blood increases. There is swelling of the liver, swelling of the brain. In fact, in severe cases, it can lead to seizures or convulsion and coma in these patients. So aspirin should not be given to children. In fact, interestingly, some of these oral pain relieving things for children, for example, your Bonjela for children when they are having teething pains, a lot of them had to be pulled from the market some time ago because these usually having the salicylate or aspirin, which could potentially lead to Ray's syndrome. Sublingual medications. Well, sublingual medications have advantages. For example, it's easy to talk with awake and alert patients and advise them to just put a tablet under the tongue. Very easy to do that. And the absorption rates are relatively quick. As we had discussed, less than 5 minutes for your nitroglycerin sublingual tablets. Also, by this route, we have some vitamins that we give by this route, like your vitamin B12. Some patients, they don't have the enzymes necessary to transport vitamin B12 from the stomach and into the circulation. So when you put it under the tongue, it bypasses that the stomach absorption and goes directly into the bloodstream. Absorption is very, very quick by this means. The disadvantage is that any medication that is placed in the mouth, it requires constant evaluation of the airways. They should not be used if the patient is uncooperative or unconscious. Nitroglycerin, the spray, and the tablets, it's used to, many cardiac patients carry either the spray or the tablet to relieve angina pain. It increases blood flow by relieving spasm and causing the arteries to dilate in the coronary arteries and veins. So the pain that the patient is experiencing is because the heart muscles are deprived of oxygen. So when you take the nitroglycerin, then a product called nitric oxide is produced, which causes vasodilation of these coronary arteries that supply the heart muscles directly. So they become nice and wide and give the heart muscles the oxygen that they need to pump. Nitroglycerin also relieves or relaxes the veins throughout the body so that less blood is returned to the heart. So it decreases the workload on the heart, and it also decreases blood pressure. All right. Before administering nitroglycerin, you have to check the patient's blood pressure. You cannot administer nitroglycerin if the systolic pressure is below 100 millimeters of mercury. Obtain orders or follow your local protocol to administer nitroglycerin. It can have a potentially fatal interaction with erectile dysfunction medications that would have been taken in the last 24 hours. So your medications like your sildenafil, which is your Viagra, your tadalafil, which is Cialis, vardenafil, which is Levitra, though all of those drugs are used for erectile dysfunction in men, and it can cause a fatal drop in the blood pressure. Never, a point of caution though, never take for granted that a woman can't be on these medications. They don't take it for erectile dysfunction, however, because that would be pointless, but they take it for something called pulmonary hypertension. That is when the blood pressure in the pulmonary system between the heart and the lung is elevated, and over time can lead to both cardiac failure as well as damage to the lung. So normally when you see your ladies, your patients on this, a lot of times they're taking it for pulmonary hypertension. Moving along. All right, so when nitroglycerin is administered by tablet, you're going to place the tablet or assist the patient to place the tablet under the tongue, and then it dissolves. The patient should experience a slight tingling or burning sensation. In fact, that tells you that the medication is potent. Nitroglycerin should be stored in its original glass container with the cap screwed on tightly. And I have some medications here, including nitroglycerin tablet, which I'm going to show you at the end of the lecture. Also, there's a cotton-like thing that is in the bottle that should not be removed. The thing with nitroglycerin tablet is that they're highly volatile. So the nitroglycerin can move from out of the tablet and into any surrounding container, including plastic containers. So we'd always want to store it in the original glass container. Once the bottle is open, it should be placed in the fridge. So if the patient is not experiencing that tingling or burning sensation, then chances are there is little or no nitroglycerin in that tablet that is placed under the tongue. When it's administered by a metered dose spray, you either spray one spray under or on the tongue. One spray is equal to one tablet. Administration considerations for both the tablet and the spray. You have to wait 5 minutes before repeating the dose. Also very important, when you come on the scene and you see a patient with nitroglycerin, either the spray or the tablet, you have to ascertain how many doses were taken before, if any. You have to monitor the vital signs. Again, if the systolic pressure falls below 100 millimeters of mercury, cannot administer nitroglycerin. Wear gloves when you're handling the tablets. The tablets, they can be absorbed in your bloodstream. Also remember to advise the patient to sit when they're taking the nitroglycerin tablet or putting it under the tongue, as they can feel a little dizzy. All right, know and understand your local protocols when it comes on to the administration of nitroglycerin in either the tablet form or the spray. Intramuscular injections. Well, the advantage is that it provides quick and easy access to the circulatory system without the need for placing a needle within the vein. The blood flow to the muscle too is relatively stable, even during circumstances of severe illness or injury. But the disadvantage, though, is that these needles, I don't know if you guys have ever seen those needles used for intramuscular injection, but they're long. And patients are normally squeamish about it, and there is subsequent pain in the area. Okay. Epinephrine is one of those drugs that would be administered via the intramuscular route. It's also known as adrenaline. It is released inside the body when there is sudden stress. It's the main hormone that controls the body's flight or fight response. It is what is known as a sympathomimetic, so it mimics the effect of the sympathetic nervous system. So you will have an increase in the heart rate and constriction of blood vessels. You can't give this medication to some persons with hypertension, hypothermia, myocardial infarction, or wheezing. It must be delivered with an auto-injector to treat life-threatening anaphylaxis. But then, remember we had spoken some time ago that your patient may be hypertensive, but what can you do if they're going into anaphylactic shock? You have to administer naloxone. Naloxone is also administered via the intramuscular route. It's used to reverse the side effects or the effects of opioid overdose. When you have opioid overdose, there's respiratory depression, which can lead to coma. It can be administered by family members or caregivers. So sometimes when you come on the scene, you find that it was administered. So you have to follow the local protocols and find out too if it has been administered by a bystander prior to your arrival. The effect of naloxone, though, is not as long-lasting as those of the opioids which a patient may have overdosed on, and so you may have to repeat the doses. Administration of naloxone, it can cause opioid-dependent patients to have severe withdrawal symptoms. These include like seizures, cardiac arrest, etc. And when these patients are coming out of their opioid depression, they can be violent, so consider personal safety. Naloxone. The most common technique for naloxone administration is via the intranasal route. The same considerations are taken for when administering injectable naloxone. So it would apply to both the intramuscular as well as the intranasal route. If naloxone is not available, then bag vase ventilations may be required for your patients who have overdosed on opioids. All right. Inhaled medications, oxygen. By far, this is the most common administered medication in the pre-hospital setting. All cells, especially those in the heart and the brain, are going to need oxygen to function properly. It's generally administered via a non-rebreathing mask at about 10 to 15 liters per minute, via nasal cannula at 2 to 6 liters per minute. If the patient is not breathing though, you must provide artificial ventilation using a bag valve mask or a bag valve device at 15 liters per minute. A point of caution, ensure that there are no open flames, lit cigarettes, or sparks in the area in which you are administering oxygen. Oxygen flammable. That could spell disaster. Inhalation medication continued. We're now going to consider MDIs and nebulizers. All right, the metered-dose inhalers and nebulizers are used to administer liquid medications that have been turned into fine mist by a flow of air or oxygen. The medication is atomized, that is broken down into very fine particles, and are breathed into the lungs and delivered to the alveoli where they have their actions. The advantage is that it's fast and it's a relatively easy route to access, but the disadvantage is that the patient needs to be cooperative and control breathing. For example, when you're administering a metered dose inhaler, we normally tell the patient to take a breath out and then put the inhaler in the mouth, depress it once, and then take a deep breath in. That can be very difficult to do if the patient is having breathing issues. Metered dose inhalers and nebulizers cannot be used for unconscious patients. That's a disadvantage too. Medication administered during a metered dose inhaler or a small volume nebulizer. These medications need a great deal of coordination. So the patient has to be able to hold it and to follow instruction on how to breathe in and out. And this, as I said before, is very, very difficult for a patient to be concentrating on how to breathe when they're having breathing difficulty. Some of these patients are so frightened they probably even forget how to breathe properly. All right, so we use a spacer, which is an adapter that's attached to the inhaler, and I have one here to show you after the lecture. It fits over the inhaler like a sleeve. So the spacer has an opening for the inhaler at one end and a mouthpiece on the other end for the patient to put their mouth over. The patient sprays the prescribed dose into the chamber and then breathes in and out of the mouthpiece until all the mist that is inside the chamber has completely been inhaled. Spacer devices are especially useful with young children who may have difficulty using a metered dose inhaler. How can you tell a 2-year-old child, oh, breathe in when you press the inhaler and hold the breath for as long as possible? That is even difficult for some adults to do, much less a 2-year-old. All right, small volume nebulizers. They are much easier to use than the metered dose inhalers, but they take a longer time to deliver the medication, and of course they require an external air or oxygen source. It can be more effective than a metered dose inhaler in patients with moderate to severe respiratory distress. It can also be used when a patient is on CPAP and during bag mask ventilation. It can easily be adapted to a non-rebreathing mask. Right? So patient assessment, patient medications, patient assessment. Patient assessment include finding out which medication the patient is currently taking. This information may provide vital clues as to the patient's condition. It may help to guide your treatment as well. It may be extremely useful too to your emergency department physicians. It can help you determine a chronic or underlying condition when a patient is unable to relate his or her medical history. Discover what the patient takes and transport the medication or a list of them with you when you go to the emergency department. This definitely is so when you are having like an elderly patient who, for want of a better word, is on a bag of medication, and some of these medications you may not even be familiar with. So it's best to pack up everything and carry with you. The emergency department doctor, this would prove extremely useful to that person. Ask too about if there's any non-prescription drugs such as herbal medicine, over-the-counter drugs, illegal drugs. For example, a lot of your patients that are hypertensive, probably their pressure is very high now because they may have been experiencing a cough or a cold for some time and they start taking a cough syrup, which unknowingly to them has an ingredient that is escalating the blood pressure. So always ask about over-the-counter meds that the patient may be on as well. Well, do not underestimate the importance of obtaining a thorough medical history. Medications are often not taken as prescribed. We have a lot of non-compliant patients. Some patients, probably due to undesirable side effects, or they Google something and Google becomes Dr. Google and they say, okay, if I take that medicine, it's going to cause me to do this. They stop taking the meds, so they're non-compliant, and maybe that's why they're having a crisis. Consider a patient's medication in the context of the clinical encounter, right? So the patient's medication may tell you what is happening. For example, if you see a patient on a diuretic, for example, you may immediately begin to suspect that the patient's difficulty in breathing may be stemming from congestive heart failure. The patient may be in volume overload. The heart is not beating properly, and so there's an accumulation of water in the lungs, and that's why the diuretics were given to pull off the water. So it gives you an idea of exactly what may be happening to the patient. For example, you're seeing a patient medication too. Always bear this in mind. A patient medication can significantly affect or alter the clinical presentation of many medical conditions. For example, in your diabetic patients, if they're having hypoglycemia, you're expecting to see sweating and may even expect some palpitation of the heart to happen. But suppose this patient is on a beta blocker, like for example, atenolol, then you may not see that excessive the sweating on the forehead or the increased heart rate. And so you're thinking that the patient is not going into shock, but it is happening. So these medications can actually affect what you're expecting to see and not seeing. Right. A medication error is the inappropriate use of a medication, and this could lead to harming the patient. I'm telling you, this is one of the most unfortunate things that could happen. Ensure that the environment does not contribute to errors. Make sure that there is sufficient lighting so you're seeing what is on the label. And you need to organize the scene, your equipment, everything, in a very orderly fashion that you know exactly what is where. Limit distractions as much as possible. Now, I do understand on the scene can be very chaotic, especially in the Jamaican setting, but try as much as possible to concentrate on what you're doing, especially when you're administering a medication. Also, consider using a cheat sheet. That could help you to remember all the crucial steps that you need to follow whenever you are administering a medication. If a medication error should happen though, then you need to rapidly provide any appropriate patient care that is required, notify medical control as quickly as possible, follow your local protocols, document the incident thoroughly, accurately, and honestly. You also talk with your partner, supervisor, and medical director. This is an opportunity to learn not to make the same mistake. What could be done differently? So you identify areas to target, during quality improvements. And this brings us to the end of our principle of pharmacology chapter.